Good afternoon, everyone, and welcome to Juan's webinar, Advancing the Status of Women in the South. We're very excited that you're joining us this afternoon, and we're really excited to hear from Julie Anderson and Jennifer Clark from the Institute for Women's Policy Research. My name is Udzi Vokiwa. I'm the Senior Program Associate at WAND, and I'll be running the technology today. Before we get started, I just want to go over a few housekeeping items. All attendees will be muted during the presentation. You can submit your questions for the presenters by typing them into the questions section of your webinar panel. It should be on the right-hand side of your screen. I'll ask these questions out loud to Julie and Jennifer after they finish their presentation. And also, this webinar will be recorded and available to view on WAN's YouTube page in case you miss anything or want to share the recording with others. Now I'm going to tell you a little bit more about our topic and our presenters. So the Institute for Women's Policy Research is very well known for their remarkable and very detailed and helpful reports. Today they're going to be talking to you more about their new report that they've done focusing on the status of women in the South. It'll give a comprehensive portrait about several indicators of women's success, including economic, political, health, and social status. Our presenters today are Julie Anderson, who's a research associate.
Udzi, can you hear me?
Oh, yes. Is that Senator Orrock?
Thank you so much, and thanks for kicking us off today. We're so happy to welcome all of our folks who have called in. We've got a robust enrollment for this webinar, and we're featuring the wonderful Julie Anderson with the Institute for Women's Policy Research. Julie's a research associate there, and she's going to give us the overview of the key findings from the report. And Julie's going to focus particularly on policy recommendations that we can embrace to advance the economic health and political power of women in the South. The full report features spotlights on special population groups in the South, such as millennial women, older women, immigrant women, rural women, LGBT women, and women with disabilities. And you can get the full report and topic area, and we'll provide you the link for that. As you can see, Julie Anderson has been with IWPR since 2015, and her work has focused primarily on the status of women in the state. She's got a master's degree with her thesis on the study of military vets in higher education, and she's researched for social science research at George Mason University, headed up a number of program evaluations, and is just a real talent that I know IWPR treasures every day. We've worked with her before in order to present. Julie, we're so happy to welcome you to this webinar today. And Jennifer Clark is the Director of Communications for the Institute for Women's Policy Research, of course, overseeing all their media relations and publications and online communications on a range of issues: women's roles in the workforce, single mothers, Social Security, paid sick days, paid family leave, and the status of women in the U.S. She comes with a rich background and is a North Carolinian, so I'm sure she's particularly interested in looking and helping educate the public on the findings and the data in this wonderful report. Thanks so much to both Julie and Jennifer for joining us, and I will pass the mic to them.
Well, thanks so much for inviting us to join you this afternoon. We love to talk about the status of women in the South and are always wanting to share the strategies we can think of for accelerating progress for women in the South. So to begin with this afternoon, I'll provide some brief background about IWPR's research and the status of women in the states project as a whole. And next we'll move on to the heart of the webinar, which is the Status of Women in the South report. And we'll call out what's new in this report, some of the key findings, and policy recommendations, as Senator Orrock mentioned. And then finally, Jennifer will point us to the array of resources that are available and different ways to access the information, followed by case studies of ways that the data have been used to inform policy that advances the status of women. And then we'll turn it back to Udzi to moderate the Q&A. So the Institute for Women's Policy Research, or IWPR, conducts rigorous research and disseminates findings to address the needs of women, promote public dialogue, and strengthen families, communities, and societies. We believe that information is power, and it's a vital resource. As much as possible, we strive to provide data about women of all income levels and all racial and ethnic backgrounds to ensure that the needs of all women are represented in an effort to end gender and race-based inequality. The Status of Women in the States is IWPR's flagship project. It was launched in 1996, and we've produced reports for every state and the District of Columbia, as well as several cities and some international reports. The project's grown to span 7 topic areas: political participation, employment and earnings, work and family, poverty and opportunity, reproductive rights, health and well-being, and violence and safety, with data by state, race and ethnicity, and other demographic characteristics. And we also rank and grade each of the states on their performance in those areas. The project's designed as a tool for agents of change, such as yourselves, at the state and national levels to use for advocacy, to guide philanthropy, and to shape policy. The Status of Women in the South report was released in February of this year. It's the first ever regionally focused report we've done, and it includes the 13 states listed plus the District of Columbia. In the report, we have new data and analysis on women's incarceration rates. We've included a new focus on rural women. We have new analysis that shows how much equal pay would reduce poverty and grow each state's economy. And we have projections for when women will reach equal representation in state legislatures. As we know, the South is both a dynamic and an influential region that has a distinct culture and history. And as in the rest of the country, despite progress and opportunities for women across many areas, there are still persistent inequalities, and they disproportionately impact women of color and those who are immigrants. So today I'm going to focus on just a few of the key findings. Here we have the median annual earnings of women and men in the South who work full-time year-round. It's not a surprise that women in the South earn less than men in the South across all racial and ethnic groups, because the same is true nationally. And while we can see that women in the South overall earned $35,000 in 2014, Hispanic women earned only $26,000, and Black and Native American women earned only $30,000. To illustrate how both race and gender contribute to the earnings inequality faced by women of color, we compare women's earnings to the earnings of white men, who are still the largest group of people in the labor force. Hispanic women earn $24,000 less per year than white men, and Black and Native American women earn $20,000 less per year than white men. And at the state level, we found that Hispanic women in Texas earn less than 42 cents for every dollar a white man earns, which is the largest wage gap for women of any race or ethnicity in the South. We know that education is a key to increasing women's earnings. This chart shows earnings for women in the South with only a high school diploma compared with women in the South who have a bachelor's degree or higher. So looking on the left at all women, we can see a significant gain in earnings for those with a degree, increasing from $27,000 annually to $50,000. Asian and Pacific Islander women experience the greatest gains, with earnings 2.5 times higher for those with a bachelor's degree than for those with a high school diploma. And for Hispanic and Black women, those earnings double. Although it's not shown on this chart, it's also interesting to note that Hispanic, Black, and Asian Pacific Islander women in the South have an even greater return on their education than their peers in the other states. And while education is clearly important for improving women's economic status, education alone is not enough. Our analysis found that the wage gap between women and comparable men, that is, men who are the same age, have the same level of education, and work the same number of hours, cost women workers in the South over $155 billion in 2014. That's equivalent to 2.8% of the entire GDP of the South. If all working women in the South were paid the same as comparable men, women's earnings would increase by about $64,000 a year. It would also have a major impact on another area of wide inequality in the South, poverty. Across all the states in the South, as in the nation, women have higher poverty rates than men. But poverty rates vary widely across the South. Even in the states in the top third, as you can see on the map, only Virginia has less than 12% of women living in poverty. Poverty also differs substantially by race and ethnicity. About 1 in 4 Hispanic and Black women in the South live in poverty, and 1 in 5 Native American women fall below the poverty line. And just as closing the gender wage gap would raise women's earnings and grow states' GDP, it would also significantly cut poverty. Our research finds that if all working women were paid the same as comparable working men, the poverty rate would be cut in half. The green bars show current poverty rates for women in the South, and the gray bars show the poverty rate if the wage gap were closed. The left-hand pair is for all working women, and the right hand is for working single mothers. If we look only at working single moms, the poverty rate would drop from 30.8 to 15.9%, so almost in half. Equal pay in Louisiana would cut the poverty rate among single mothers by a remarkable 61%. And to further demonstrate how important women's earnings are, not only to themselves but to their families, and the potential benefits then of closing the wage gap, this chart shows the share of mothers from each racial and ethnic group who are breadwinners, meaning that they're either the sole providers of income for their families, or for those who are married, that they earn at least 40% of the household income. The chart shows that there really aren't large differences between states in the South and states outside the South in the share of moms who are in that breadwinner role, but it also shows that the vast majority of Black mothers, almost 4 out of 5, are breadwinners, and more than half of Native American, Hispanic, and women who are multiracial or of another race are family breadwinners. In fact, there are more Black breadwinner mothers in the South, which we're just counting as 13 states in the DC, than there are in all the other states combined. So next I want to share a few findings related to Southern women's health and well-being, since health is so closely tied to employment and to poverty. Compared with women in other states, Southern women have higher rates of heart disease and breast cancer mortality. They're more likely to have diabetes or AIDS, and they have more days per month that they report their mental health is poor. Mississippi has the highest heart disease mortality rate in the United States, and Black women in Mississippi have the highest mortality rate of any racial or ethnic group in the South. I was also struck by the fact that although heart disease mortality among women is generally going down, the mortality rate for Hispanic women in Tennessee and Native American women in Louisiana rose between 2003 and 2013, which is just an example of the kind of thing that may go unnoticed until we take a closer look at the trends in each state. But in some good news, Southern women are more likely than women in the rest of the country to receive preventive care, including things like cholesterol screening, mammograms, and testing for HIV. Given that women are the fastest growing population in U.S. prisons, we also looked at female incarceration rates. Between 1980 and 1998, the female inmate population increased by 485%. In 2014, the national rate for female incarceration was 65 women per 100,000. All of the southern states except for North and South Carolina had incarceration rates above that national average. And Kentucky had the highest rate, 108 per 100,000 women, and North Carolina had the lowest rate at 48, which was less than half the rate of Kentucky. And two other violence-related issues that were frequently raised by our Southern advisors were human trafficking and homicide. Under the category of what's promising, we found that although 4 Southern states, Texas, Florida, Georgia, and Virginia, are among the 10 states in the nation with the highest number of reported cases of human trafficking, each of those states had passed significant laws that are critical to effectively combat trafficking, punish traffickers, and support survivors. But under the banner of what's disappointing, 11 of the southern states accounted for over 1/3 of all female homicides by a male in 2013. And although the vast majority of female homicides committed by men occurred between intimate partners, and more than half were committed using firearms, only 4 of the 13 southern states, Louisiana, Tennessee, Texas, and West Virginia, and the District of Columbia, had barred those convicted of misdemeanor domestic violence crimes from gun possession. And before I wrap up key findings, there were a few points regarding political participation of women in the South that I'd like to share. As you know, nationally, women are more likely to vote than men. We discovered that in the South, women are even more likely to vote than those nationally. In fact, 10 of the 14 southern states have voter turnout rates for women that are higher than the national rate. with Louisiana and Mississippi having the highest rates, both at nearly 60%. And on the other end, women in West Virginia, Texas, and Arkansas have much lower voting rates, around 40%. But women from the South are less likely to hold elected office. States outside the South are nearly twice as likely to have a female U.S. representative as states in the South. 7 of the 14 southern states have no female representatives, and I won't list those for you because I suspect you may know them. And interestingly, we found that southern women of color are less likely to be represented at the federal level than are non-southern women of color, but they are more likely to be represented in state government. So for example, nearly half of the black female state legislators in the U.S. serve in southern states. We also found that if progress continues at the current rate as it has since 1975, women in West Virginia and South Carolina will have to wait over 200 years to reach parity in their state legislatures. But 10 of the 13 southern states are predicted to reach parity in their state legislatures before parity will be achieved in the U.S. Congress, which we project as 2117. So in closing my portion, I want to share just a few policy recommendations that can address the issues I raised. First, to strengthen women's political participation. I don't need to tell you that we need to encourage women, and particularly women of color, to run for political office. We need to expand campaign training for women and tailor that training to women of color. And we need to continually educate the public and call out the reality of campaigning while female. And I think life is ripe with opportunities to do that. And especially in the South, which continues to attract large number of immigrants, women who are undocumented are particularly unempowered and are vulnerable to exploitation. The federal government could increase pathways to citizenship, which would give more women the chance to vote and increase their political voice. And states could do their part by removing restrictive voter ID laws that prevent women, including some women who are citizens, from voting. To support employment and increase earnings for women, we have to enforce fully the Equal Pay Act and state equivalents. As we saw, there's no single greater policy lever than equal pay to increase women's earnings and to grow the economy. And to address even greater disparities in earnings for women of color, employers should be transparent about wages and promotion criteria, and they must allow employees to talk about their pay and share information without fear of retaliation. And finally, it's crucial to develop a policy infrastructure that supports work-life balance. Keeping in mind that in half of all Southern families with children under 18, mothers are breadwinners in their families, work-life supports are essential. Paid family and medical leave and paid sick days, benefits that are not available to the vast majority of workers in the South, can keep parents in the workforce. We know that in many families, if someone needs to step back from work to step up to family caregiving needs, it makes sense for the lower earner to be the one to dial back, and often that's the woman. But that time out of the labor force is nearly impossible to recover from in terms of wages, promotions, and retirement income. Even though parents in the South tend to have access to high-quality, affordable child care compared with the rest of the nation, it's still out of reach for many lower-income women. States must continue to invest in early child care and education and ensure that parents have access to child care subsidies whether they have a job, they're looking for work, or they're pursuing education or training. So those are just a few of our key findings and a few recommendations. The full report, as Nan Orrock mentioned earlier, also contains spotlights on specific populations including immigrant women, rural women, LGBT women, and millennial and older women. And now I'm going to turn it over to Jennifer to share all the ways we can access the information and examples about how the data are being used.
Excellent. Thank you so much, Julie. So for my portion, I'm going to give an overview of the ample resources that we have available and a couple of ways that some people have used it around the country to inspire change and actual real progress for women around the country. So first and foremost, our website, statusofwomendata.org, has all of our research and data related to the project. We have national and state level data available as downloadable spreadsheets so that you can take the data, use it, reuse it, and figure out how to use it in your own work. We have also, in addition to data in each of the topic areas that Julie mentioned, we have demographic data for each of the 50 states in the District of Columbia. As you'll see on the right-hand side of the screen, there are 7 different topic areas listed: employment and earnings, poverty and opportunity, work and family, violence and safety, reproductive rights, health and well-being, and political participation. And each of these topic areas has its own interactive map, its own rankings, and its own data set that you can download and use depending on which areas you work on. In addition to our 7 in-depth topic areas, we also have spotlights with national and state level data on millennials, older women, immigrant women, women in unions, and women living in same-sex households. In addition to it being just a treasure trove of data on women in all of the states, it is also the most accessible, comprehensive source of national and state level data on women of color in the United States. We even include detailed racial and ethnic breakdowns, so you can find out even how much of a wage gap there is within Native American tribe, for example. For the South in particular, statusofwomendata.org/South is the home for all of our resources related to our regional look at the status of women in the South. Here you'll find the full report available for download. It's 260 pages full of wonderful data and analysis, and if that's too much for you, we also have the executive summary that has an overview of key findings and policy recommendations, including the ones that Julie just outlined. We also have each chapter available for download in case you want to focus in particular on employment and earnings, or you're more concerned about political participation. You can download each of those chapters and their references individually. And we also have updated South-specific data that we updated for the South report from our national 2015 report. As I mentioned earlier, each of the topic areas have their own in-depth areas on the website. There are 7 in-depth topic areas and interactive maps. And if you mouse over each of the maps on the states, you'll get state rank, the grade in each of the topic areas. And if you click on the state, it takes you to a specific state page. I chose North Carolina because, as Senator Orrock mentioned, I am a North Carolinian, and I always use it as an example. So on each state page, and this is the North Carolina one, for example, you'll see that there is a report card summary over here on the right. That gives an overview of how the state was scored and graded in the national report and how it ranked nationally with each of the other 51 jurisdictions. This, I think, is a really useful tool when you are trying to discuss how your state does in relation to other states. And as an example, the Chicago Foundation for Women recently announced their 100% project, which aims to improve their grade on women's employment and earnings in Illinois from a B- to an A. So depending on policy or legislative priorities that you may have, it's a really good way to benchmark progress that you want to see achieved. In my home state of North Carolina, I hope that they'll take many of these D pluses and try to make measurable progress on them to get them up to a B or an A. In addition to the report card summary and links to each of the different topic areas, there's also key stats on each key indicator in each of the sections, plus data on each of those indicators broken down by race and ethnicity. So you'll be able to see what the wage gap is in the state of North Carolina. You'll see how the state of North Carolina ranks on the wage gap, and you'll also be able to see how each of the major racial and ethnic groups rank on the wage gap as well. In addition, the last thing that I'll note on this page is that you can access the state fact sheet, which is great for printing, for downloading, printing, distributing. It's an excellent at-a-glance document that can be taken to meetings with community leaders, policymakers, or colleagues. It includes trend data on each state, where you can see areas of improvement or decline over the last decade. So for instance, in North Carolina, you could see whether the wage gap, whether there was any measurable progress on the wage gap in the last 10 years. And if there was a decline, obviously there is something, you need to make some changes. Okay, and so then we also have many other resources available on statusofwomendata.org. We have the 51 state fact sheets, which I mentioned. We also have infographics and sample social media that can be shared to highlight the findings for each of your states. In addition, we also have sample press releases available and key findings documents with overviews of each topic area. I think those are helpful, especially if you're talking to the press or if you're talking to any other leaders and you want to talk about the key findings.
You hadn't been, oh yeah, it says missing a mic.
Okay, so next is I'm going to talk about some of the ways that people around the country have used the data and resources to improve the status of women in their states. So as Julie mentioned, we've been doing the Status of Women in States project since 1996. One of the examples in the last 10 years was that we worked with the Women's Foundation of Arizona to release the economic status of women in Arizona, which informed budget decisions in two different budget sessions that increased funding for domestic violence shelters and increased funding for child care subsidies. The Status of Women and Girls in New Haven was another report that focused in on a particular area of Connecticut and was used as a platform by the first woman elected mayor of the city. More recently, in this last iteration of the Status of Women in the States, 2015, the Women's Foundation of Colorado used the findings from the report and shared copies of the Economic Status of Women in Colorado, a special briefing paper that we worked on with them, with every member of the Colorado General Assembly. And they've referenced the report in testimonies that they've provided on several equal pay bills that have appeared this session. They also do a lot of grant making around gender equity in the STEM workforce, and they used the report to inform some of their advocacy and grant making work on women in STEM. In addition to their programmatic and advocacy work, they also used the research to lift up and shape conversations that were happening in their community. So they focused on the disparities for women of color in Colorado and were able to highlight this issue in the media and also highlight their work on combating this issue through their grant making and through their policy work. Another example in Seattle was the Women's Funding Alliance. In addition to using the report to highlight the findings to the media, they also used the report to do their own educational outreach to other grant makers in the area to inspire other grant makers to understand what an issue gender equity is and to make change in Washington. As another example, over in Pennsylvania, the Women and Girls Foundation of Southwest Pennsylvania, they've been doing a lot of work around women's political participation and getting more girls involved in leadership roles. And they used the findings of the report to highlight a program that they were already doing in Pennsylvania to garner more recognition for that work. And in conclusion, that's an overview of the resources and how people have used the findings and the resources around the country. Julie and I are available for any and all questions on either the findings, the resources we have available, how to download, what you can do with them, that kind of thing. Definitely find us on the internet at statusofwomendata.org. You can find us on Twitter. Be sure to use the hashtag StatusOfWomenSouth or tag us, IWPR research on Twitter. And with that, I'll turn it over for Q&A.
Thank you so much, Julie and Jennifer. It was really, really helpful, really detailed, and discouraging yet encouraging at the same time. So thank you so much. I just want to remind all of the attendees how to submit questions. There should be a question feature on the right-hand side of your screen. You can type the questions in there, and then I'll ask them out loud to Julie and Jennifer. So my first question is from Dolores Bischoff. And Dolores asks, why is DC included as one of the southern states?
Well, we included the southern states from our definition of the southern states were from what the historic Confederacy plus West Virginia and Kentucky, which are considered in other research reports to be sort of the technical South. We included DC mainly because, to be quite honest, our funder had a very specific interest in the status of women in the District of Columbia, and we really wanted to do a more in-depth look at the status of women of color in the South and in each state, and so. We included DC so that we could also include, do a deeper dive into women of color in the District of Columbia as well.
Great, thank you. So our next question is about political participation. What are some of the best practices for encouraging women not only to vote, but also to support other women who may be running or considering running for office?
Well, I think other research finds that women in particular seem to need more encouragement to sort of take the leap into running for office. So research finds that if women and men run for office, they both have fairly equal odds of, winning, but that women need sort of a greater nudge. And my own theory about that is just like a lot of sort of professions, occupations, because it's sort of slow to have women in those offices, I don't know that people grow up sort of envisioning themselves in those roles. So it's just a matter of time to kind of normalize that and just additional encouragement. If you think someone would be great at it, get you and 5 friends to tell them that you think they'd be great at it. And as far as voting, I have a lot of faith that I think that is changing with the new generation. I just feel like that millennial women, younger women are very politically engaged, and I hope that women's voter rates are just on the up and will continue to grow.
Thank you so much. I think we couldn't agree more at one about the importance of encouraging women to run and supporting them. Our next question is from Elizabeth Gedmark. Elizabeth asks, from your research, are there policy initiatives in any southern states that do advance opportunities for women that other southern states might model or learn from?
The policy level is difficult. I think what we see is that a lot of things, like we tied the violence thing, it seems like a natural fit to look at gun laws in a state. So what's the state doing to sort of address the fact that there's a lot of gun violence? And things like reproductive rights, we sort of deflect the common narrative that that's all about abortion, and in fact point out that particularly in the South, like low-income and rural women, they get the only health care they have at all from a Planned Parenthood. So we just need to sort of decouple that story. And so I think it's easy to see where things are going wrong, and I guess the flip side is that, if we don't have voter ID laws, then that does not deter women and people of color from voting. If we don't sort of stigmatize and make efforts to shut down Planned Parenthood, that continues to be a resource for women for both reproductive health, but also for health in general. So I think there are a handful of those things, and I think more and more we will see that the states that did not expand Medicaid will continue to be the states with poor health and high rates of poverty.
Yeah, and I'll also add that in terms of, efforts on the ground that are trying to tackle these issues, I know that women's funds in particular women's funds that are based in the South are really making a robust effort to incorporate two-generation solutions into some of the policy agendas that are advancing in the South. You know, in Mississippi, for example, IWPR has done a separate report with the Women's Fund in Mississippi on female community college students and the socioeconomic supports that they need in order to complete college, get that degree, and then have better options for higher paying jobs. I mean, as you saw from Julie's slides, the return on education for Black, Hispanic, and Asian American women is greater in the South than it is in the rest of the United States. So, you know, making sure that women are able to complete their degree is a big part of that. And some of the ways that they're tackling that is childcare on community college campuses, making sure that that student parents have access to, you know, whether it's transportation help or any other of these socioeconomic supports that can help them complete a degree so that they can then use it to find a job with family-sustaining wages.
There's just some great ideas for sure. Next question, can you dive a little bit more deeply into your research around millennials and kind of some of the differences that you saw between millennials and other age groups?
Well, I can start by saying that one of the findings that we didn't expect was that there was one state where millennial women actually do out-earn millennial men, and that's New York. So millennial women in New York earn $1.02 for every dollar earned by a millennial male in New York. Now that to me was a surprise. I was sort of expecting millennial women to be making less than millennial men in every state, just from having seen the wage gap and how pervasive it is over the years. But then when I thought about it, I was like, wow, there's only one state. And when you're talking about the youngest cohort of workers, and that there's only one state where millennial women are making more than millennial men, it's sort of a head scratcher. Millennial women are also far more likely to have a bachelor's degree than millennial men in every state in the country, which is different than it is for women overall. They are also far more likely to live in poverty than millennial men in every state, and that's also true for women overall. But when you take into account the fact that they have higher educational attainment in every state, but then they also have lower earnings in almost every state, and they have higher poverty rates in every state, there's clearly a mismatch here. So on the sort of employment and poverty side, those were some of the main findings for me. Mm-hmm. Julie, did you have anything?
No, I think you just did a pretty thorough job. Good job, Jennifer.
Oh, and I think I will say that some of the other things that we found was that the health insurance rates for millennial women, the rate of uninsured vastly declined after the implementation of the Affordable Care Act. So there are quite a few other sort of findings for millennials in both the national report and also in the South report.
Great, thank you. The next question is, you mentioned, that you've done this report since 1996. So can you speak to some of the trends that have changed most significantly since 1996 and the ones that have not changed?
Yeah, the South had relatively higher scores on the reproductive rights index. Now that's relative to all of the other indices that we tracked. It doesn't mean that they did well on reproductive rights. It just means that they did worse in the other categories. But I would say that one of the trends in that category is the number of the pieces of legislation that have been enacted in the last few years, not even just in the last 10 years, but in the last 5 years, that are seeking to limit women's reproductive health access. And so I think that, you know, maybe not reflected in the grades on that index, but if that continues to happen and we continue to grade them on these states, I think we're going to continue to see a decline in those grades instead of progress there.
And you know, I would say that in the South, as in many states, it's sort of counterintuitive, but wages are very, very flat, and yet in some cases the wage gap closes. And the way we look at that is if you look at real earnings, so you know, you adjust for inflation, and many of the states, both women and men have seen a decrease in earnings, but men's has been even greater. So it isn't as the good news story that we would want, the wage gap's closing because, you know, wages are going up and women's are going up even quicker. But in some cases, it's just that, you know, men's have stalled completely and women's tend to kind of creep up a little bit. And, you know, in some cases, the wage gap is small in a state because the earnings of both men and women are relatively low. So, you know, the wage gap has been stuck, and that's not just in the South.
Mm-hmm. I would also add that one of the other like fast trends that has happened nationally, at least, is that women's educational attainment has just skyrocketed. And you know, we looked at women getting bachelor's degrees in the 80s versus the 90s versus the 2000s and now the 2010s, and the rate at which they surpassed men getting a bachelor's degree is very quick. And then I would say that another interesting trend, in addition to Julie highlighting the very fast trend in increasing incarceration rates for women, they're the fastest growing prison population, I would say that there were some interesting trends in health and well-being. Women are less likely to die from chronic diseases, and so sort of their physical health improved, whereas they are more likely to report having more days of poor mental health per month. And suicide rates among women also skyrocketed. So there's this mismatch between women's improved physical health and declining.
And I would just add one more thing. If you're interested in that by state, those are great because they do very quickly give you a 10-year snapshot of trends on a lot of them. It's a handy resource and not a lot to decipher.
Great. Thank you so much. Our next question, have you seen any effective social media campaigns that increase women's political involvement?
I guess that's a little bit outside of the scope of our research, but you know, as the Director of Communications, I spend a lot of my time on social media, and I think that it is innate. There's an innate sense right now that among young women in particular, and in particular young women of color, that social media has really been a rallying device, and that, you know, it's there's civic engagement, and then there's, you know, political engagement or political representation, and so there is sort of an innate sense that there's a lot more that social media is really helping people to unite and lift their voices and spread the word and to become more engaged civically. I think I would be very interested to see how that plays out in terms of connecting it to progress and political representation. One of the findings that I thought was interesting in the South in particular is that Black women have the highest rates of voter turnout of anyone, of any racial or ethnic group of any gender, they vote at just much higher rates. But they also have the lowest rates of representation in elected office. So again, there's sort of a mismatch between you know, the participation put in and then the representation that women get politically.
That is indeed a very interesting trend. All right, well, I think we have taken all the audience questions, so I just want to say again a very heartfelt thank you to Julie and Jennifer. This is great information, great discussion, and we really appreciate you sharing your time with us. And I also want to thank everyone who joined us at home on their phone or on the computer. We ask you to please share your feedback with us on the survey, which will appear when the webinar ends. And we'll also be sending you the webinar recording by email. So again, thank you so much and enjoy the rest of your afternoon.
Thank you.